Colorectal cancer is one of the most common cancers in Western countries, representing one of the main causes of cancer deaths globally. It develops from an uncontrolled growth of the cells that line the internal walls of the intestine, more precisely the colon or rectum. Among the most important risk factors, we find diet, as there are some foods that, if consumed in excess, can increase the risk of developing colorectal cancer. But which are they? Let's go see them. Red meat. When we talk about red meat, we are referring to all those meats that contain a greater quantity of myoglobin, a protein present in the muscle fibers of cattle, pigs, sheep, goats, and horses. While on the one hand, they represent an important source of high biological value proteins, vitamins, and mineral salts, on the other hand, excessive consumption of red meat has been associated with a series of health risks. In 2015, the International Agency for Research on Cancer, after a careful review of over 800 studies, included red meat in Group 2A, that is the one where probably carcinogenic substances are found. The association between red meat consumption and tumors has been observed primarily for colorectal cancer, and to a lesser extent also for stomach and prostate cancer. A meta-analysis carried out by the IARC working group highlighted the existence of a dose-response relationship, where each daily portion of 100 grams of red meat is associated with a 17% increase in the risk of colorectal cancer. The mutagenic effect of red meat is attributed to a number of factors, including the presence of iron in the heme group, high-temperature cooking method that favor the formation of carcinogenic organic compounds, such as polycyclic aromatic hydrocarbons, as well as N-nitroso compounds in the colon. These are a group of chemical compounds that can form both endogenously, during digestion in the gastrointestinal tract, and during the processing and preservation of meat, especially when preservatives such as nitrites and nitrates are used. Processed meats. The term processed meats refers to all those meat that have been subjected to salting, drying, and smoking processes with the addition of preservatives in order to improve their flavor and prolong their shelf life. In the processed meats group, we find cooked ham and raw ham, bresaola and bacon, but also mortadella, salami, and sausages. Among processed white meats, we find sliced chicken and turkey, generally sold in convenient packages. The International Agency for Research on Cancer has included processed meats in Group 1, which includes compounds that have shown sufficient evidence of carcinogenicity for humans, such as alcohol and cigarette smoke. It is estimated that a daily consumption of 50 grams of processed meat increases the risk of developing colorectal cancer by 16%. The main reason for their carcinogenicity is due to the use of nitrites and nitrates during industrial transformation and conservation processes. Among the most common, we find sodium nitrite and nitrate and potassium nitrate. Once ingested, they can undergo metabolic transformations that lead to the formation of nitrosamines, carcinogenic and genotoxic chemical compounds, capable of damaging DNA and increasing the risk of colorectal cancer. Ultra-processed foods. Quick to prepare, tasty and pleasant to the palate, ultra-processed foods are all those packaged foods ready to eat, or simply to reheat. Although they have become part of the daily life of millions of Americans, behind their apparent simplicity lies complex industrial processes, which profoundly modify their structure and composition compared to the starting foods. Just read their nutritional labels to discover a long list of ingredients, often little known, including additives, colorings, preservatives, and artificial flavors. A study published in August 2022 in the British Medical Journal analyzed data from 3 large observational studies involving over 200,000 American adults who were followed for more than 25 years. The results showed that a high consumption of ultra-processed foods in men and some subgroups of ultra-processed foods in men and women was associated with an increased risk of colorectal cancer. Ultra-processed foods include many ready-made and frozen meals, sugary drinks, products sold in fast food, and many packaged snacks, sweet or salty. These foods are typically rich in added sugars, fats, and refined starch that alter the composition of the intestinal microbiota, contributing, among other things, to weight gain and obesity. According to a study conducted by researchers at the University of Bristol and the International Agency for Research on Cancer, eating more ultra-processed foods could also be associated with a greater risk of developing cancers of the upper aerodigestive tract, including cancers of the mouth, throat, and esophagus. In conclusion, we have seen that excessive consumption of red meat, processed meat, and ultra-processed foods is closely linked to an increased risk of developing colorectal cancer. However, while experts recommend limiting the consumption of these foods, it is advisable to do so without excessive concern. It is therefore important to follow a varied and balanced diet, rich in fruit, vegetables, and whole grains, which promote intestinal health and help reduce the risk of developing tumors, including colorectal cancer.